Nighttime bedwetting in children, especially older kids, could be really one of the most psychologically painful experiences of their life and is linked to a lot of other major mental issues. I'm Dr. Rodney White with Omaha Chiropractic, and today we're going to talk a little bit about the potential causes behind bedwetting and what can be done about it, or at least what the science shows. So, bedwetting, or what's otherwise known as technically as nocturnal enuresis, is defined as the involuntary loss of urine at night in the absence of organic disease at an age where a child should be expected to be dry, of which the general consensus these days is about 5 years of developmental age. Obviously, that's different if we have a severe autism case or something like that, where we have an older child, but developmentally and mentally they're under 5. The problems with it is it's often associated with things like sibling teasing, parental disapproval, repeated treatment failure, lowered self-esteem, of course, and a massive impact on their mental well-being and social life. And there's even evidence that it's actually being linked to a higher risk of physical and emotional abuse, which is just horrible because these poor kids aren't doing anything that causes it. They've got no disease process there, and it's really hard on them. And so there's two types. There's primary nocturnal enuresis, which means they've never really been consistently dry. And then you have secondary, which we'll talk about too. So in primary enuresis, it can happen even as late teens, but especially preteens, and usually it's in kids who are sleeping deeply. They are finding that sometimes there might be a problem with neural integration, and we'll talk a lot about that soon, but basically that means in a normal functioning body, think of a safety pin that's done up. We have the brain up the top, the bladder down the bottom. Bladder has the signal that it's full, sends the signal up to the brain. Brain then sends the signal back down, telling everything to hold on. Well, something's going wrong in these kids where either that bladder isn't getting the signal to the brain, or the brain can't tell the bladder and the muscles to hold tight. And this suggests that there probably is some kind of developmental delay between the way the brain and the body communicates. There's no science to show this, but I have seen certain hypotheses shown where when we miss certain milestones, like crawling properly and things like that, it could be potentially linked to it more. And there are a number of associated risk factors, meaning they can't say these things cause it, but they often see it in the lead up to it. A family history of bedwetting, a very deep sleeper, and they're actually finding some correlation where if we stop exclusively breastfeeding before the age of 4 months, a child is actually more likely to be a bedwetter. Now again, we don't know if that's a cause or not. Secondary nocturnal enuresis is quite simply when a child has been dry for at least 6 months and then they revert. Usually, in most cases, this is either due to a medical condition like a bladder infection or from some kind of emotional stress. So conventional, normal medical treatment is usually one or a combination of these three things: behavioral therapy, alarm therapy, or pharmacological therapy. However, none of them really have any good evidence that suggests they work. Nothing that necessarily says they're dangerous outside of the pharmacological stuff, but there's no strong evidence that says that it'll work. So a lot of parents go to more natural options, one of which is chiropractic. Now, why do they go to chiropractic? Well, most chiropractors who have been in practice for more than a year, especially if they specialize in pediatrics, have had probably multiple, maybe many cases of parents telling them that, hey, since my child's been getting adjusted, and usually after only a handful of adjustments, their bedwetting has gone away, usually very spontaneously, almost like we've flipped a switch. Now, that's obviously not going to be every kid who bedwets, otherwise there'd be all this research and we'd be telling everyone to go to a chiropractor when their child is bedwetting. But we do know there seems to be this link, at least chiropractors are seeing it anecdotally. So this is where science starts. We see some anecdotal evidence. Then we have to do more testing to determine, is it just pure lucky coincidence that these chiropractors are seeing them at the time that it was going to stop? Or is there something to it? Now, logically, it makes sense that chiropractic may be able to help because we know from the research that chiropractic does improve the way the brain and the body communicate. We've seen that over and over in the research. So logically, maybe chiropractic does improve it. So from the anecdotal evidence, we then have to move to case series and case studies. and see if there's something to this. Now, a case series or a case study does have a lot of problems in that it's not strong enough to conclusively come out and say something can help, because it doesn't account for randomized blinded trials and natural progression and things like that. But there are a number of small case series and case studies to back up some of this anecdotal evidence. There's one in particular where they followed 33 patients for 12 months, and 22, or which is 67%, showed a reduction of bedwetting in the follow-up period. And again, while this is a great result, we can't go jumping from the roof saying, hey, everyone needs to bring their kid who's bedwetting into a chiropractor because it could potentially help. So then we have to move to more major clinical trials. And the problem with chiropractic and bedwetting is there really hasn't been enough done. There was a major one done that we'll talk about here that the Cochrane review, who is the gold standard of science reviewers, looked at. And what's interesting is usually if there's only one major clinical trial, they'll look at that and say there's not enough evidence to come to any conclusion. But they actually came to a conclusion that there is weak evidence, meaning there's not enough, there's weak evidence that chiropractic could get favorable results for kids who bedwet. Now that's huge. That means this study really was a good study, because otherwise they would have thrown it out and said, there's no evidence. We're not saying it doesn't work or can't work. We're just saying there's no evidence. But when they say there's weak evidence that it's favorable, they're saying what's there is favorable. There's just not enough of it. So what was this major study? Well, a clinical trial took 46 kids who were bedwetters. 31 were put in the chiropractic group. 15 were put in a control group to receive a fake or a sham adjustment. They measured frequency of bedwetting 2 weeks before the trial, measured it throughout the trial, and measured it 2 weeks after. So the kids in the chiropractic group got 10 weeks of chiropractic care. The control group got the fake adjustment. At the end of the trial period and then the 2 weeks following it, the control group had no difference. The frequency of wet nights was exactly the same where they started as it was at the end. The chiropractic group, however, went from an average of 9.1 wet nights to 7.6 wet nights. Now, you might look at that and say, well, that's only 1.5 nights less over the period. That's not that big a deal. But when the Cochrane reviewers looked at the data more closely, they found that 25% of those kids had more than a 50% reduction in wet night frequency. And so for 1 out of 4 kids, that is a huge deal. It's a major, maybe life-changing thing. So yes, it's a small study, but the Cochrane reviewers gave it very positive look at and results. So we absolutely need more research for us to be able to say, hey, you should take your bedwetting child to a chiropractor because they can help. We can't say that. But the big takeaway is this: parents who have children who are suffering from bedwetting really should consider at least getting their children checked by a chiropractor, preferably a pediatric chiropractor, because for that child, it could have a huge impact on their quality of life. There's really nothing to lose because, like we've talked about in other podcasts and blogs, chiropractic safety record is enviable and it's second to none, especially when it comes to kids. And so there's no real risk there. The only risk is that it doesn't work, and a good chiropractor is going to be able to tell you fairly early on if your child has the right neurological issues going on in their spine where we believe we could be able to help. So it is as close to a risk-free treatment as possible as out there. And until we get more research, there's still nothing else really that shows any better benefit than chiropractic. So it is well worth a shot. So if you have a child who's suffering from bedwetting, look up a pediatric chiropractor and get them checked. See if they find anything. If you're in the Omaha area, we'd be more than happy to have a look and help. You can go to sapicchiro.com, check out what we're all about, and make contact with us. So thank you so much for your attention if you've made it this far. If you've got any questions, send us a message or leave a comment below if you're watching this video, and we'll see you all next time.